peeps are here. I am so happy.
Morning. So happy to be here.
My peeps.
Hello, everyone. This is Kim Peak.
Hey, Kim from the library.
Yes.
Oh, I love it. I didn't say this in my message I left for you, but I love the library. They know me at my neighborhood library. I love it.
Right, good.
Hi
Hey,
everybody. Hi Susan.
Hey, my Kristen. How's the baby doing?
Not good. I got a call.
Okay, well, you know what? We are just happy that you're here, and I'm glad that we're on Zoom so you can't spread that stuff around.
Yeah.
All right, we'll just,
You You're on mute, Suzette.
You just hit music. You muted yourself, Suzette.
take me off. I want to talk with the people. Hey, James. Did you get a chance to James? Did you get a chance to get in touch with the guy from Beloved, or no? You just left him a message. You on mute, James. James, you're on mute.
Look, now I'm on mute. No, he hasn't called back. I was gonna try and give him a call after our meeting today.
Okay, cool. Thank you. Cool beans. Thanks a lot.
Yes, ma'am. No problem.
Okay. Oh, look, and James McCombs is here.
Hey, good morning.
Okay, well, you know what? It's 5 after. We're going to get this party started. Kim, I'm ready.
Okay, we're live.
Hey, LaSherry. Hey,
Good morning,
girl. Okay.
Hello.
All right.
Good morning. All right. Go ahead.
So good morning, everyone. Hey, my baby Ariel. Good morning, everyone, and welcome to our Zoom party. And I was not here last month. I'm, dealing with some family stuff, but I am here now. So thank you, everyone, for joining us. I am Lion Suzette Logan, and this is the National Provider Network, formerly known as LAN 53. At the National Provider Network, we strive to bridge the gap between people and resources. The National Provider Network brings together organizations, schools, and agencies to support the community, local and national. We are a professional network aimed at breaking down and erasing barriers to education, health, mental and physical, and supporting economic stability for youth and their families. Locally, the National Provider Network represents youth and families in the townships of Bloom, Brennan, Ridge, and Thornton, the South suburbs. And each month, the National Provider Network has a goal of increasing access to educational and mental health support by highlighting innovative services, programs, and presenters. We have a wonderful one today, who address mental health, well-being, social, emotional learning, educational services, along with economic and community development. So once again, everyone, welcome. And what I'm going to do is I am going to call people so that you can introduce yourself. And then you can tell who you are, where you're from, and a little bit about what you do. Okay? So actually, the first person I'm going to call on is April McMurray White, and she is one of our presenters today. So she's just going to give you a brief synopsis of who she is because she's going to present later on.
Good morning, everyone. I am so excited to be here. Just a little nervous, but excited to be here. This is one of maybe like 2 or 3 encounters with this organization. But again, my name is April McMurray White. I'm located in the southwest suburbs of Chicago, Illinois, of course. We provide health and medical services throughout the south suburbs of Chicago and surrounding areas, mainly to schools and communities. So again, that's just a brief overview, which I'll be sharing more today. Thank you.
Thank you. Thank you, April. Don't even be nervous, girl, please. Don't even worry about that because this is family here and we're having our party. Okay. So the next up is my guy, David Spellman. David. And we got to do the commercial for you because I do have your book. But okay, David.
Good morning, all. My name is David Spellman. I am located in Charlotte, North Carolina. I'm a man of many different trades, but most notably, I wrote a book on how you can use social and emotional learning and connect it to hip hop. So just like music, as you can see, Suzette holding, social emotional learning inspired by hip hop. It's always a pleasure to be here.
Thank you, David. And he didn't say, but you can get his book on Amazon. Thank you. Okay, next up, we have my girl, April.
Hi, good morning, everyone. Happy to be on the party bus today, Suzette. April Tolbert, Cook County Department of Public Health. I'm in our Community Engagement and Health Education Unit. We are the health department for all of suburban Cook County, and we're here to connect with you all in many ways, and happy for the presentation, Namesake April. I'm just looking forward to hearing about what's going on in the community. Thanks for having me, Suzette.
All right, no problem. Thank you. And thank you for coming. Next up, we have Janine. Am I saying that right? Janine, right?
Yes, ma'am. So my name is.
What happened, Janine? You back on mute, baby. Janine? Okay, there
Okay,
you
can
go.
you hear me now?
Yeah.
Okay, it just automatically muted, but my name is Janae Delano, and I'm a
Janae.
community educator. I work for Satoma Star Services in Matson, Illinois.
Well, welcome. And you
Thank
know what?
you.
I understand that Satoma and Star merged, and so now it's
Yes,
Satoma
ma'am.
Star. And my girl Gia Washington, I was gonna call her to talk to her about that. But you know what? We can get your information. We could talk to you, and maybe next month you can come on and tell us about the merger. Okay.
Okay, yes, ma'am.
All right. Well, welcome, my darling. Okay, so it's Janae, right?
Yes, ma'am.
Okay, Janae. All right. So welcome, my darling.
Thank you.
You're welcome. Next up, we have Jacqueline Lawrence. Jacqueline. Okay, there you go.
All right. Good morning, everybody.
Hey.
Hey. I am from the Department of Children and Family Services, Resources, and Recruiting. I am here on behalf of you guys and my dear cohort, Giovanna Smith. I don't know if she's on this morning.
She is.
But we are here to gather resources that we can share with our youth in care and their families, and also within the community outside of our walls. So thanks for having me today.
All right, Jackie. Thank you for being here. I know we have talked in the past before.
Yes,
but yes.
I'm
Thank
back.
you for being here. Yes.
They have me back on. So
all right. Okay. All right. Next up, we have James Flagg, my friend. James, where'd you go? What happened to him? Okay, well, I don't know what happened to James, but we'll come back with James. Okay, so we have Giovanna. Hey,
Good morning, everybody. And I am following my cohort, Jacqueline Lawrence. We are both from Resource and Recruitment. And we love coming to the last meetings to always let you all know that we are in definite need of foster homes in our Black and Brown communities. So please share. And if at any time your organization wants to have a presentation, please reach out to us. Thank you.
Not a problem. Not a problem. Okay, next up we have LaSherry Carroll.
Good morning, everyone.
Hey.
So my name is LaShari Carroll, and that's okay. And my organizations provide nursing and transportation resources to schools and other community organizations. So we're just happy to be on the party bus as well.
All right. Okay. And you know what? I'm going to call you later because maybe we could get you next month to come on and talk about what you do and we can highlight your organization.
That would be great.
Okay. Thank you. And next up, we have Kim Peak. Hey, Kim. I like those glasses, girl. You on mute, Kim. You are on mute.
Gotcha.
Okay,
Good
there you
morning,
go.
everyone.
Hey.
Thank you for inviting me. My name is Kim Peak. I'm the director here at the Harvey Public Library in Harvey, Illinois. So again, thank you for inviting me. I look forward to listening to everything here.
Okay, no problem. Love the glasses.
Thank you.
Next up, we have Monica Whitaker. Monica. Okay.
Okay,
there
I'm
you
here.
go.
I'm here. I'm not that technology savvy.
Girl, me neither, but it's okay.
Okay, well, I'm with the Department of Children and Family Services, and my cohorts are Giovanna Smith and Jacqueline Lawrence. And this is my first meeting, so I'm very excited.
Well,
I'm from
welcome,
Resources and
darling.
Recruitment. Thank
Welcome.
you.
Okay. All right. Next up, we have Jada English. Jada.
Good morning, everybody. I am the Program Administrative Assistant for Family to Family Federation for Children's Mental Health. And I just want to say thank you all for joining us this morning and for having me too.
Thank you, Jada. Jada is our newest baby, and she knows all about the technical stuff. So we are so happy to have her and have her to help Kim, because I know nothing about it. But okay. Next up, we have Ariel Donovan. Ariel Donegan.
Hey, everybody. I'm Ariel. I am from Northwestern University as well as DCFS, but I'm also the Director of Membership and Marketing for Family to Family. So welcome, everybody.
Hey, Ariel.
Hey, Mama.
She's a daughter of my heart. Next up, we have Nancy Aguirre. Nancy, it says connecting to audio.
Can you hear me?
Okay, because Nancy, I see two spots on you are. Two spots.
I see that too, and I've been trying to get rid of that little monster over there in the corner, but it won't go away. So
okay, maybe Jada could do something. I don't know. But I am so glad you're here, Nancy. This is my girl too.
Thank you. I'm Nancy Aguirre. I'm from the Community and Residential Services Authority out of Springfield, and we are a state agency who assists parents in accessing special education services and or residential treatment options for their children with mental health disabilities or developmental disabilities and behavior disorders.
Well, welcome. And you know, I did send a invite to your friend, to your coworker, Kim Johnson. Yeah.
I'm really excited because Kim is actually our Cook County coordinator, and she may know a lot of you already. So I'm really excited to have her come on board. It's just a matter of kind of getting schedules together and things like that. So.
Okay. All right. Well, cool beans. And I'm glad that you are here, my girl.
I'm glad to see your shining face.
Okay. Next up, we have Kristen Hadley. Kristen.
Hi, everybody. I'm Kristen Hadley. I'm the President, Director, and CEO of I Love Myself with CP and ADHD Networking Group. We are a networking group for people with disabilities, and we also under the umbrella of Family to Family also.
All right. Well, thank you, Kristen. Thank you for coming. And you know what? I hope you feel better, baby.
Okay, thanks, Susan.
You're welcome, Kristen. Next up, we have James McCombs. James, what happened to you? Where'd you go?
Oh,
what
I'm not
happened
sure.
to? Okay, there you go. I see you up there. Hello?
Okay, you can see me. Okay.
Well, I cannot see you, but I see your name. But I hear you, so that's good enough.
All right. Well, my name is James McCombs. I'm a SNAP Ed educator with the University of Illinois Extension. to promote healthy eating and physical activity. And I look forward to learning more about all the partners here today.
Thank you, James, and thank you for coming. Okay, who we have next? Tamiko, and I see you say you have to leave early, but please introduce yourself. And okay, there you go.
Hi, everyone. Good morning. I am Tamiko Dockery. I am the community liaison for Hartgrove Behavioral Health System and Garfield Park Behavioral Hospital. Well, Hartgrove have 160 beds and Garfield Park have 88 beds to treat pretty much every mental health and psychiatric disorder. And thank you for having me.
Thank you, Tamiko. And you know what? I wasn't here last month, but I heard you did a great job. So thank you, my darling. I appreciate you so much.
Oh, thank you. Thank you so much.
Okay. Next up, we have Allison. And don't you dare talk about that sunny weather in California.
Hi, family. How you guys doing? I am Allison. I'm in Southern California. I am in the business. I am in the business of educating people on getting out of debt, investing, and making sure they're properly protected. Thank you for having me.
All right. I love you. And I hopefully will see you in December because I will be in California in December.
Yes.
Okay. But that's a whole nother thing. We'll talk about that later. All right.
Okay.
Next up, we have, is it Shamika? Am I saying that right?
Yes, my name is Shamika. I'm happy to be here. I am the Deputy Chief of Staff for April McNary, Met Advocacy, and thank you for allowing me to be here on the party bus. Thank you.
Okay, yep, on the party bus, baby, okay. Next, well, welcome. Next up, we have Ms. Hawkins.
Good morning, everybody. My name is Faith Hawkins. I am the program coordinator with Book Family Advocacy Center located in South Holland. I'm happy to be here, and I just want to say if anybody is interested in being a guest speaker for one of our parenting classes hosted every Tuesday at 5:30 virtual, let me know.
Oh, cool beans on that. Maybe Giovanna, you want to talk to her about that. But Ms. Hawkins, I think you sent me an email about referrals for the LGBTQ community.
Yes, ma'am.
Did you connect with anybody or do I need to give you some more information?
No, I was able to get the young lady some services. Thank you.
You're welcome, my darling. See, that's what we do here, you know, and while we have this, I'm gonna just do this little commercial. That's why it's very important that we encourage people to sign the linkage agreement with us, because what we do is we pass on information and resources to our partners. And that's a perfect example of what we do. All right, so next up we have Tila Mims, my girl from the North Side.
Good morning. Great to see your shiny faces. How are you? I am a bit under the weather, doing double time in the kitchen, trying to make my own self some chicken noodle soup. But grateful to be here. I am a fellow Lion. I am probably got this cold from advocating for my own child. I'm a parent advocate, and I do a lot of project work with Family Voices on healthcare related issues. So grateful to be here. I will flip my camera on and off, or you'll see me flipping some stuff in a pot. But either way, I'm grateful to be here.
Thank you for coming, Tila. And you could just save us some of that stuff. Okay, so
that's what I may have to do. Thank you. Thank you.
Okay. Next up, we have my girl, Kawan Taylor. Kawan, thank you for coming.
Good morning. Thank you for having me. I am one of the DCFS supervisors at the Harvey site office. I'm standing in for our area administrator, Tracy Marshall. So great to be back. I think I've missed last month. So just looking forward to hearing the upcoming presentation.
Okay, cool beans, Kawan. Well, I missed last month too, so it's all good. But, you know, just a little bit of information. Kawan and I go way back. I used to be the supervisor of a a SAS team, screening, assessment, and support services. And Kawan was one person that was wonderful and helped us with what we were doing. So I am so happy to have you here. So thank you, Kawan.
Good to be here. Thank you.
Okay. Next up, we have Kelly Jones. Hey, Kelly.
Good morning, everyone. My name is Kelly Jones. I am a health educator senior with Cook County Health Department in our Community Engagement and Health Education Unit. I'm glad to be here. Good to see you all.
Okay, thank you. And you know what, Kelly, thank you for the information that you sent us, the 2 emails that you sent me, and I passed them on to Kim and to some people on our stream. But thank you.
Fantastic.
Okay. And last but not least, we got my guy, James Flagg. He disappeared, but he's back.
Yes, ma'am. I'm back. I had a few tech issues, but I'm here, still on the bus. Thanks for having me, Suzette. Good morning, everybody. Happy to be with you. James Flagg. I am the Community Service Block Grant, or CSBG, Outreach Manager for CETA of Cook County. My department services all of suburban Cook County, but we have resources that stretch throughout, all of the different areas or borders, or boundaries of Cook County, starting with our LIHE program, which just kicked off October 2nd. So happy to be with you all. Thanks, Suzette.
Oh, no problem. All right, so we're going to get this party started. So sit back, get your coffee, your tea, soda, water, whatever, and sit back, and we will have our presenter for today. Her name is, oh my God, what happened? Oh, wait a minute, I'm coming back. Something happened. Okay, here we go. Her name is April McMurray White, and she is the CEO and president of Mad Advocacy. And Ms. White will discuss a collaborative approach to connecting health services within the community via a mobile clinic platform. So Kim, I know that you had some information that you want to put up for April, and she had a slide that she wanted to put up. There you go. It's coming. And once she puts that, oh, there you go. And April, I want to say welcome and thank you, my darling, for doing this presentation for us. And the floor is all yours.
Thank you. Well, I won't be very long before you, everyone. But again, thank you for having me today and allowing me to speak. As I explained earlier, we are, and as Suzette just shared, we are a mobile healthcare service organization. However, we're not mobile in the aspect that everyone thinks of. A lot of times you think about the little mobile pretty vans and buses. That is not what we do, although we have partners that do that. What we found, we needed to mobilize healthcare. And when we mean mobile, when we speak of mobile and say mobilization, we actually bring healthcare to the communities, to the schools. We set up services, we have the equipment, we go out, we have a provider. Our wonderful medical director, she's just coming in from Dubai, so she's not able to join us today, but Dr. Felicia Davis, she did 20 plus years with Cook County Hospital. So that's why we're able to do this, because she was in retirement, but like she always told me, she never retired. So this is something that's dear to her heart that she wanted to do, because our focus, although it's on the underserved communities, is mostly Black and Brown out in the south suburbs of Chicago and surrounding areas. But right now, our main focus areas is South Suburban, because what we found out during COVID, we began doing COVID tests and immunizations for COVID at the schools, for quite a few schools throughout the south suburbs. As I was speaking with some of the superintendents out in Fort Heights and Calumet City and a few other areas, that maybe not that large of a population of underserved, but it's there, Matson and so on, right? And Park Forest, they stated, they asked me, they said, what are you going to do after COVID? And I said, well, not for sure. We still want to bring service to the community, and we know COVID's not going anywhere. So as we collaborated and communicated, we found that there was a need for more services, not just for the vaccination for COVID, but when it came to immunizations and school physicals for the school. So since Dr. Davis had already given us permission to, do COVID, because you can't do it without it, of course, because we're working under her license. We are a legal HFS certified company. We decided, and we, with her collaboration, that we would do health physicals for them and physicals. So what we do, as I stated before, we mobilize the health services that we provide. So just recently, I don't know, some of you may or may not be aware of, but in Illinois, there's a deadline date for students, and it's October 15th. And it's usually like the kindergartners and the sixth grades, because if they're missing vaccinations and a physical for those points in school, then unfortunately they're going to be excluded, right? And we don't want to see that with our babies. You don't want to see that in any community, okay? But unfortunately, in the Black and Brown community, it happened more often than it should, because the parents are usually busy, they're working, or what have you, or grandma and grandpa may be the actual caretakers of the kids. They're unable to get these things done. So what we found after doing some research, and based upon the areas that we service, because they are underserved areas, they're 90% Medicaid populated, we was able to provide with other partner companies, and also as well as ourselves, for Vaccine for Children, to do the vaccinations for them as well as physical. So we brought all this together by connecting resources, and that's what we currently do. So we're able to have a nurse practitioner come out. It may not always be Dr. Davis, but under her license, a licensed nurse practitioner will come out, and nurses, of course, to provide those services to the children. And we would set up equipment in the actual classroom. So our long-term and long goal vision is to be actually school-based. Although we are classified as that, we are in the process of making it official. Some of you Cook counties people may be familiar with that type of services. For those of you that are not, you may or may not be in some type of capacity aware of school-based service. It's very much needed throughout the United States right now, because they are finding that the school can be a hub, and should be a hub, for more services such as this. So we know mental health is a big thing as well, but not only for mental health, but for preventative service such as the mental health, and for substance abuse, because they're finding there is a need, with cannabis and kids vaping and things of that nature has been brought to our attention as well, which maybe perhaps in the future, if resources allow, we would like to expand and provide that service with connecting partners. So again, our main aspect of the company is to mobilize healthcare services. We try to fill those gaps of care by connecting other resources. So for instance, we do partner with other agencies. Right now, one of our partner agency is Family Christian Health. They have been a super major partner in this. We wouldn't have been able to do some of this stuff without them. I don't know how many of you are familiar with them, but they're located in Harvey, Illinois. They do come out. They have a bus. They do a lot for the community as well as us. But it takes, as I know, it takes a village. We always hear that, but it does take a village, because people say, well, they're already doing it. Yes, but they have that big, beautiful van, if any of you seen it, that bus that they take around. But because they are a station clinic as well, they may or may not always be able to get to some of the places. And then sometimes the bus just may not, be I don't know what I'm going to say. It may not meet the needs of the school. They may not have a parking area for it, and so on. So that's why with our services, they're so unique, because we're able to just go in there, whether it's a classroom that they're not using, a conference, or just a dedicated, classroom, a nurse's station. Long as we have running water facilities, we're able to get those services done, to meet those guidelines. So that's who we are. Just to expand a little bit, because I know, I don't see what that screen went, but I have my notes here. See that we, on my logo, as you can see, we're planting seeds of healthcare. Some of the seeds, so to speak, CEEDS, that was just a play on word that our deputy came up with. Some of the seeds that we point out, that we focus on with this collaboration when we connect and have these services done, the importance are correlation of care, community outreach, culturally awareness, competence-based care, cost-effective, closing gap in care, and connection to healthcare resource. I know that's a mouthful, but those are things that are needed in the underserved communities. And especially, like it or not, you know, we have a large population of migrants coming out. So we're sitting down, we're trying to figure out how can we, you know, help them? How can we better that process? I had a nurse practitioner that was out at the school a few weeks ago. She shared with us, you know, what's going on with Chicago, because sometimes she helps with those events. And she said, April, you know, which IDPH has reached out. You may want to, you know, have a team go out and assist with that. And I said, you know what, that's something that we should, you know, talk about and consider, which we've been talking about with the schools, because although we're small right now, but we're growing, that is something that we would like to service. However, because we're mainly focusing on the South suburbs, because a lot of time there's not a lot of resources like ours available. I mean, they're there, but it's just not enough providers to provide them. So I've had discussion, because we know that the migrants, they're going to be dispersed throughout the state, and a large majority of them probably are going to come to the South suburbs, right? So we know we're going to have the students and the adults in the communities. So we're coming up, you know, with programs and ways that we can help them, you know, far as getting their immunizations, getting those physicals, keeping up with those things so that the kids can stay in school, and we can keep our schools safe as well by having kids vaccinated and immunized. So again, those are just some of the things that we're looking at. It's been a pleasure to meet Kim and Suzette, because one of the things that Kim said when we first encountered her, and I never forget being on the line, there was like several, I was the only healthcare provider there, so to speak, as an organization, but there was like multiple mental health providers. And then I knew of one that I wanted to make that connection with for their group. And I said to Kim, I said, well, it's like, aren't you going to overlap services? You have multiple providers for mental health on this line, maybe about 4 or 5 at that time. And she said to me, no, because you know why, April, there's never enough services. There's and you do hear that a lot. And it just dawned on me with that thinking, because we're not always able to service everyone. You always hear, well, I didn't know where to go, you know, from the community, or they don't have an appointment until 2 or 3 months down the line. And by that time, it may be too late for whatever the situation is. So by her saying that awoke something in me that says, you know what, she's absolutely right. So we need to connect, bring all the providers together, and make sure that the services are being provided for those communities that need it. So that's why with our organization, Med Advocacy of its own, we are opening to partnering, you know, because we can't do it all. We would like to, we want to, however, it's all about collaboration. So we collaborate with other community healthcare partners to get these services done. So rather Family Christian, if they're there and we need to just team up and they do so many healthcare events, and, you know, maybe if there's 100 people there, they're doing 50, we're doing 50. We get it done within that day's time. We are figuring out ways how to work together, because that's what it's about, in order to bring these services to our community so that there are no excuses why they're not getting done. Another thing that is real large on the radar right now, just back in April, Governor Pretzner, he did approve expanding school-based health services. So if you all get a chance, and Suzette and Kim, I would like to do another presentation on that, maybe, you know, come the new year, because that's really big, because there's funding out there for school-based to expand on that for services that are needed. And I can share with that what that entails, because there are incentives for the schools, so that way, as we are providing services for these mainly, and again, most of these are Medicaid patients, as you're providing those services, whether it's mental health, occupational therapy, or healthcare services such as ours, just about anything that you can think of, just about, long as it's within that scope of services that they approve without authorization, we would be able to network with you to provide those services and help the school see some incentive from that, because the state has a program in place for that based upon school-based, but I won't go too far into that. I get so happy. I have so many ideas, so much information that I just like to share. Anybody that knows me, knows that I love sharing information. One of our nursing partners, she's on the line, Miss Carol, she has come out along with a colleague of hers to help do nursing as well as transportation as well, because sometimes the parents, they don't have transportation to get the kids to where they need to go for services. Because although we're there, we're just doing preventative services, but there's need for some things that we don't currently offer, but we do plan to expand and offer. But right now, because we're just focusing on those school physicals, vaccinations and immunizations, maybe flu and some screening for diabetes, but there's some stuff outside of that scope that they're needing. So, we also let them know, hey, we know someone with transportation, we can get you connected so that they, that company can provide those services. So again, it just takes so many different partners as myself, as you all on this line, to get these things done. I know we're all, some of us may be located in different areas throughout Illinois or even outside of the state itself. But again, we know the communities we service. We want to bring those services, with like-minded people. We are open to connecting, to show you how we get it done. I have a healthcare background. That's why I was able to, initially, I didn't even really, I'm not going to say I didn't want to do this, but I'm going to say it wasn't quite in the plan because the scope of the business was quite different. And even as I go through now, we are restructuring some things the way we do services. So before, like now, although we're still, promoting mobilization healthcare services, what we're finding is that we need to rebrand. So I am going to share, Suzette will be sharing my website, but do know that will be updated in a few weeks. So that's going to have another wealth of information for you, because that was just to show our presence online. But now that we know the direction that we need to go and where we need to be with the healthcare services, we're more so finding that we're classified as a managed service organization in the community. This way, when I say managed care, not a managed care, managed service, the MSO, managed service organization, we're just showing, our motivation and our connection to manage the services, because we've met and we do meet so many other partners like yourself on the line today, in different agencies that say, hey, how can we help with that? Hey, I want to be involved in that. And we do. We try to make that happen. I have a nutritionist, that she's going to provide some services that we provided, we've demonstrated to the school that can come into play, just working with her, understanding who we are, understanding the kids, what they eat. And it's all about a cultural approach to healthcare in Black and Brown community. Now, that doesn't mean that I don't love everybody. It's just that these tend to be the underserved communities. So that's why we're showing such a large focus on that, because there's a need. They're being underserved, sometimes it's not even by default. It's just that, like I said, the parents, they're too busy to take the kids in. So we at the school, we can be that care for them. We can provide those services. And that's what we've come up with under our mobilization program to fill those healthcare services, those gaps of care. And although right now we're mainly just focusing on, like I said, physicals, vaccinations, and immunization, there are other things to come into the future that we plan to implement. But of course, one thing at a time. And although the program itself with, just officially implementing it is new, because we did a soft grand opening back in March to a group of superintendents and school admin staff at Cooper's Hall. Everything was paid for. Miss Carol was there to represent her company as well. And we all shared and collaborate how we can bring these services together. And what works, what we found, what we're finding, what works, what don't work, how to make these connections. We had other partnering organizations that was there to support us. So again, we're just trying to expand again, although the program itself is new. We're not new to healthcare. We're all experienced. Like I said, Dr. Davis, she has over 20 years with Cook County, but she's bringing that knowledge to us to help manage our healthcare team. I've worked for Northwestern before I stopped working to go on my own, and other major healthcare organization, over 20 years of healthcare. And I said, you know what? I'm going to take what I learned and bring it back to the community. And like I said, although I never really planned to go this route, because my route was more in the, we were thinking of billing. However, when we found that there was a need in the actual community to be there on ground, to coordinate care, to, to make it culturally appropriate, not that you're just out there coming to provide a service. No, you got to know the people that you're dealing with, that I'm finding, because as we all know, our communities are not always like other communities. And I say that's just because of the culture, because of the areas that you're servicing. So you have to have providers that look, it helps. I'm not going to say you have to, but it helps to have providers that look like the communities that you service. So that's one thing that we do focus on, only because of trust issues. We all saw what happened with the COVID vaccines, right? But by us having providers, nurses, and our medical director and the nurse practitioner, as they're coming out there to talk to the community, and doing assessments and everything before administering their shots, that makes the community feel better. That lets them know, hey, these people know what they're doing. They know what's going on. And also in the schools, it helps the kids, although they may not always see doctors or nurses until something goes wrong. This let them know that we're there as well. Just like when we were doing COVID swabs, we were able to interact, and our physicians and our clinicians, that is, to interact with the kids and let them know, hey, this is something that you can strive to be as well. You see us, as the same as you, the same color community person coming out, that kind of motivates them. And let them know to stay out of trouble. Hey, I want to I may want to be a doctor one day. I may want to be a nurse. So we just look at all of this as a picture, as a whole, when we bring these types of services to the community. No, it's not just us coming out there just trying to provide us services as a business to make money. We've given back so much to different school districts that we've serviced. We've actually reinvested money, which hasn't been a lot of money, but we reinvest a large portion of that, whatever we do make, back into our program, which is going to service the community, to ensure that this program continues to grow and go, so that we're able to properly service the community and provide those services, so that we are, financially stable. We have all the, certifications and all the requirements that are needed to make sure that we're properly servicing the community and we're meeting those standards. So again, hopefully I didn't share or go overboard. I just got a little excited. That's Med Advocacy. That's who we are. I would love to share more. Like I said, we're constantly learning new things that can help the community as a whole, even your program. Feel free to give, to call me or email. I'm sure Suzette and Kim will share that as well once they share the slides. Thank you.
Oh my God, April. Wait, am I off of mute? Okay. So, oh my God, April, it was wonderful. Oh my God, it was wonderful. I want to say thank you. And now I am just going to open it up in case people have questions for you, if that's okay. But just while you were talking, I was thinking about this, and I was thinking about James McComb, who's over at the University of Illinois, and he has a healthy eating program. This would be someone that you would want to partner with, and this would be very important for people to sign the linkage agreement with us, and then we can make referrals, or we can give you information so resources can be shared. So Jen, if you're still on and you're listening, this is Kim is gonna put April's information up, and you can contact her. And then also I really tried to contact the Family Christian Health Center so that they could be on the call. But you know what? Since you already work with them, I am going to talk to you, and you can give me a contact. And then
she's out of town. Yes. That's why I just talked to her last night. My apologies. She's out of town. We'll need it.
Okay. All right. Okay. But we'll in the future. All right. So anyway, so I'm going to, James, you are very welcome. Okay. So first of all, we have the hand raised from Kelly Jones. Kelly, you have a question?
Yes. Oh, Miss April, you are right on time. So again, Kelly Jones with Cook County Health Department. So first of all, are you free tomorrow at 2? Let me tell you why. I host a health meeting with suburban schools monthly. Our meeting is tomorrow at 2 p.m. The subject is mobile vaccinations.
Oh, wow.
We have been told, yes, this is Kismet. We have been told by our school community that they have the exact problem that you are speaking about. I have a couple mobile vaccination organizations presenting to the schools, and I would love if you could come on and talk about what you are doing, because we're, like you said, we are trying to present these options to families who otherwise don't have the options to get out to get these vaccinations done. So if we could connect and I could talk to you a little bit more, it would be fantastic. It's perfect timing.
Oh, no, awesome. Absolutely. We would love to do that. Yes, absolutely.
I'll put my email address in the chat. Thank you so much.
Perfect. Okay.
All right, next hand I see is James Flagg.
Thank you, Suzette. Thank you, April. This is a great program, great presentation. I really appreciate the ability to connect with providers that look like me, or people that look like me connect with providers that look like them, and have shared experiences. That's a part of that wraparound medical care. I was wondering, do you have any flyers or any type of tangible information that I could take back and share with my agency? We have an information referral line for Suburban Cook, and we would love to help you get the word out, and at the very least generate awareness within CEDA, within my agency, but send that out to some of our public facing partners and customers as well. So is there a way I know you said you're going to share your email and phone number, but can I get that information, or can we get it so we can put the word out about the great work you're doing?
Oh, absolutely. So I can email you directly, my Deputy Chief of Staff, Shamika, if you can make sure you're getting all the information for me, and we'll get that to you right away, a flyer, and then perhaps we could connect and have some more conversation, because another thing, like I said, just so much information. What we try to do is customize our approach. So if we're servicing a church, it may be a little different versus what we're doing in a school or at City Hall. So each approach, when we do come out, just to let you all know, we do customize them. Okay, there is customization in this, because again, it's important that it's culturally appropriate, no matter who we're servicing. Immigrants, we can be servicing Poland migrants or what have you, but we're gonna customize that approach and make sure we have a diverse group of staff out there to help service the community as much as possible.
Understood.
That we can. Okay,
perfect. Thank you. And I do have one more question, if you don't mind.
Sure.
And I'll put my my information in the chat. I could send you a private message with my information as well. I guess my other question is there a cost or a fee to the student or the school when it comes to your services, and how is that cost covered? I just want to just know who pays for it. Is it the responsibility on the patient or the customer, the school, or how does that work?
So good question. So we do have to have a consent in order to, of course, treat and to bill. So normally what happens, which one more thing I didn't share and touch on, a lot of times the parents can't be there when we're doing the services. So the superintendent and the school nurses would stand in as proxy, but this is pre-work that we already have done so that we can assist the students. Now, right now, it's heavily Medicaid population that we're services with the vaccine. Okay, that's what we're seeing a large need with. Those are the ones we want to target. However, and to answer your question, no, normally your insurance, we take all insurances will pay, but because of the way the program is structured, the VFC program, that one, I don't want to say they have restraints, but it's more targeted to the uninsured, Alaskan or Asian American, I believe it is. And then if you have Medicaid or Medicaid MCOs. So if a child comes in, like my child, she's under my husband's insurance through the state, because he works for the state, I can't use that vaccine to service her, okay? However, because they have a private batch for that. But we can talk about all those things. That's why we're here. We have other vendors that we can connect with that can get that done. So I won't go too much into that. But to answer your question, normally if there is a cost, because even with our connecting partners, there's very small costs. Now, anyone can get a physical, I should say, because what we did this year, the kids, like there was a mixture of kids, like it was probably like 70-30, maybe, or 20% of the kids probably had private insurance in some of the communities we service. So what we said and did, we're not going to deny seeing them. We went, or they may didn't have any insurance. We saw everyone. We went on ahead and did sports physicals, which we do too. We kind of had to write that off, but we did so the kids could play sports because the state does not pay for sports physicals, but that's okay. That's an extra customer service that we wanted to offer. But we were able to do the regular physicals along with that so that they can stay in school and play sports. The vaccine and physicals are normally paid for by their insurance, I will say, depending on their plan. But if they have Medicaid, state covered and funded insurance, it's normally almost always covered. Again, we would just have to look at those things. And again, we would just work with you to, go over that community.
And if you're okay with that, I'd love to, talk more offline. I don't want to dominate the conversation.
No,
but
absolutely. Those are things I'm glad, because those are things that I meant to share. So thank you.
Oh, no problem. But yeah, thanks for the presentation, and I look forward to
absolutely.
All right. Anybody else have any questions for April? Or does anybody else want to make a comment? Okay. So April, once again, I want to say thank you so very much for coming on and presenting. We greatly appreciate you, and the information was phenomenal. So thank you so very much. One of the things that we do here on the platform is we have a spotlight called the Mental Health Spotlight. And usually we have a mental health facility or a hospital or a therapist or something that comes on and gives information, but we don't have that today. So it's just going to be me. So I would just like to say that we celebrated this month World Mental Health Day on October the 10th. The CDC Center for Disease Control and Prevention reports that more than 1 in 5 adults live with mental illness, and over 1 in 5 youth between the ages of 13 and 18, either currently or at some point in their lives have had a seriously debilitating mental illness. So this is a reminder that every mind matters. Let's foster understanding, empathy, and support for one another, especially people dealing with mental health issues on a daily basis. And remember, if you or anyone you know is experiencing a mental health crisis, contact 988, which is the Suicide and Crisis Lifeline. And it is a lifeline that will connect you to services locally in your community. So just remember, there is help out there for people experiencing a mental health crisis. So I just want to say thank you for everyone who participated. A couple of announcements, and then I'm going to turn it over to Kim. Please add your name to the attendance sheet so that we can provide a certificate of attendance for you. And then second of all, please, please, please sign the linkage agreement, because we want to keep this party going. So again, once again, April, thank you. We appreciate you so much. And now I'm going to turn it over to Kimberly.
Thank you, Suzette. It is always such a pleasure to be in the background and hear how well everything is going. And so I really just wanted to kind of take this time to kind of thank everybody for continuing to come out and support. And one of the announcements that I want to make is we will not be meeting in the month of December. That is the time that our team normally gets together to kind of look at how we're going to plan for the following year. As Suzette mentioned, we really want you guys to do the sign-in sheet. You know, we mail out a nice certificate of appreciation. And also these are good if you guys need to have documentation that you are attending these types of meetings where we're receiving so much really good information. And then the linkage agreement is really helpful because as you can tell, Suzette is really at the center of a lot of things, and she's able to, on the fly, make these connections. And, you know, we've seen these connections be very beneficial to those that are in attendance, because we know, and April, you really brought it home and saying that as we look at some of the things that are happening in the South suburban communities, one of the things that is very evident and very evident, and it's a need that we serve, is having those connections. Because if we're out whether we're doing community outreach or we're in the schools or we're attending other meetings like this, when the need comes up, we have people out of this network that we can refer. And so, you know, we've done that with quite a few people who are either providing direct services or organizations that we give this platform to so that they're able to make the connections that they need in order to grow their businesses. So one of the things that I wanted to just kind of reinforce is understanding, like, we come here and Suzette really does a good job of making us feel comfortable. We're having a good time. And honestly, I look forward to our monthly meetings. Sometimes it's stressful in the background, but I love to hear all of the things that everybody's doing. And I just wanted to let you guys know that this is actually a process and an approach that we are taking that is actually having an impact. So I wanted to just kind of go over and share with you a little bit about family to family, because we don't necessarily provide a ton of direct services, but what we do is advocacy and education. So us bringing everybody together and encouraging these conversations across multiple sectors. We'll have schools, we'll have law enforcement, we have medical providers, we have our behavioral health care people. We just did an assembly at one of the schools with the DEA. So being able to really promote these types of collaborations on behalf of improving mental health. We also provide program capacity building services. One example is we help people do things around marketing. A big issue that we have in the South suburbs is access. We have a lot of very well-funded and very well-heeled organizations, but you also have the problem where the average person does not know a tenth of the resources that are provided. So we do things that people honestly seem to overlook when they're writing for their own funding, which is developing content, helping organizations to get their word out, actually posting things like this on YouTube so that people can research and find, and you have a better opportunity of finding your services. We're working with Ariel, who's our Director of Membership and Marketing, who also is responsible for updating the statewide database. So when you put your information in that linkage agreement, not only are you giving us the information that we need to share with people who may be in need, we're also making sure that information is part of the statewide database. So that database is where like DCFS and some of the other organizations go into to find providers that are relevant to the needs of a particular family or within a geographic location. We also do work around evaluation. So understanding, and those who've been around the LAN network for a while will remember that we have lost funding along the way because we haven't really embraced the idea that while we're making these connections, it's important for us to be able to track our outcomes and explain those outcomes to our funders and to our supporters. So our goal in all of this is really to help strengthen families and to help really push those protective factors. And we look at two things, violence prevention and drug prevention. And we look at those because for those that may be aware, when you look at substance abuse addiction and the continuum of addiction, all of the things that we're talking about fall under that umbrella. And in the South suburbs, we have a huge issue. We have a very large issue of kids that are not going to school. So it's very important for us to try to bring your resources so that they're accessible to the community. You know, we want people to be able to walk to receive services, you know, or for these services to be able to come to them. And specifically looking for community-based providers. We're in definite need of additional resources that are geared towards small groups, non-clinical, social skills development, mentoring, tutoring, and those things that promote social and emotional learning. Then the other thing I wanted to kind of clarify is our work with the Illinois Department of Children and Family Services. So we are currently the convening agency for the Permanency Enhancement Project for the Cook South region. That covers Bloom, Bremen, Rich, and Thornton townships. So we are looking for people who would be interested in becoming a part of that committee that really digs into looking at the data that we're getting from DCFS around the number of kids who are entering the child welfare system. It's probably an overstatement to let you all know that there is some disproportionality. Of course, we have way more Black and brown kids that are entering into the system at a rate that's higher than their proportion of the population. We want to be able to help mobilize you guys. I think that one of the things that we've seen is there's a ton of networking groups like this, and I think I've already heard a couple of people mention meetings that they're having that are similar, maybe have a slightly different focus, but being able for us to come together and really look at how we can provide these services that everybody's offering, but also look at how we're making an impact to reduce these kids being abused or neglected. And for us as a team to be able to really come together around what will be our collective goals. So that is one of the reasons that we try to make sure that we are collecting and seeing who's attending, as well as asking you guys to participate in these linkage agreements. I also wanted to bring up another opportunity that is actually coming on later on this evening. There is another statewide initiative that is scheduling a relaunch. It is SEL for Illinois. They are a subsidiary of SEL for US. So SEL for US has these chapters in about 20 different states where they bring stakeholders together to look at addressing the social and emotional learning skills of youth and families. So I am a big advocate for the inclusion of the community and really focusing on building these relationships between these organizations and agencies. So I would really encourage you all to attend. The meeting is at 6:30 this evening. It's about an hour. They are also looking for people to fulfill key committee roles, leadership roles. So it is an awesome opportunity, especially if a lot of us are really grassroots, to kind of get into a network where you're also building those relationships with schools throughout the state. So if you do your attendance form, there is a question on there to ask if you want to be updated on the SEL for Illinois meeting. So if you click that, I'll get your information and be able to share. I'll be able to share the meeting information with you. So those are my few announcements. Oh, also, if you guys have announcements that you can share with us, we do have a couple of things. We try to send it out through the listserv. There's about 50 people on that throughout the state. That listserv is one of the resources that we use for the Permanency Enhancement Project. And then we also have our own listserv that we use to send out the meeting notices and so on. So if you get that to me, I can include it in some of the things that we send out. We'd be more than happy to do that. All right.
Okay,
I'll turn it back over to you. I'll turn it back over to you, Suzette.
All right. So, thank you, Kim. And I just want people to know that Kim is the brains behind this operation. And without her, this would not be happening. And without her, I would not have the opportunity to see all of you each month. But so Kim, thank you so very much. And she didn't introduce herself because I skipped over her, but she is our executive director and she is our fearless leader. So thank you, Kim. So I noticed that 2 people joined a little bit late. The first person that I saw is Kimberly Johnson, and she is a co-worker with Nancy Aguirre. Kimberly Johnson. She is with the Community and Residential Service Authority, and she is with Nancy. So Kimberly, if you want to, Kimberly Johnson, if you want to say a few words about who you are and about the organization that you work with, I just want to say welcome to you. And if you want to have a little, if you want to make a statement, that's cool. You could do that too.
Hi,
So please.
everyone.
Okay, thank you.
Can you hear me okay?
I can hear you now. I can hear you now.
Great. A little bit under the weather, but very good to be here. Thank you, Nancy, my amazing coworker, for inviting me. My name is Kimberly Johnson, and I do work for Community Residential Services Authority, which is funded by ISB, but we're a state organization providing advocacy and technical support, helping families navigate this very complicated system sometimes. Many of you may know me. Hi, Kristen, I think you're on here. I was formerly the administrative lead for Chicago Public Schools in the Office of Diverse Learner Supports and Services. So I'm really happy in this new role, able to cover the entire Cook County area, whereas before I was just with CPS schools. So now I can do all schools within the Cook County area. And then we have three other amazing regional coordinators that cover the other parts of the state. So good to be here. I'm looking forward. This is an amazing platform, always has been for me. So thank you guys so much for all you do. Really appreciate you.
Oh, Kimberly, welcome. So glad that you can join us. And then you know what? You could put your information in the chat box. And then if people need to contact you, they can do that. And the second person that came on a little bit later, he didn't get to introduce himself, is John Patterson. And he's with us every month. So I just want to say, hey, John.
Hello. I'm sorry, I'm
That's okay.
multitasking here. So I'm John Patterson from the Department of Children and Family Services. I do help Kimberly along with the Permanency Enhancement Project. So that's one of the things I do, but I'm actually the Family Advocacy Center Outreach Coordinator for Cook County. So we work with Book in your area to provide services to families in need services with the department.
So John, thank you for joining us as always. Okay. A pleasure. And the last thing I want to do is, this is just a commercial for my guy. He had to jump off, but his name is David Spellman Jr. And he wrote this book, Just Like Music, Social Emotional Learning Inspired by Hip Hop. And he is out of North Carolina, and he is a fellow Lion. And this is an absolutely fantastic book, and you can get it on YouTube. Amazon. You can get it on Amazon, but the information, you can pull it up on YouTube, but you can order it on Amazon. So I just want to just put a little commercial for my brother, David Spellman Jr. Okay. All right. So does anybody else have any announcements or comments they want to make, Kim?
Yeah, I wanted to just congratulate Kristen Hatley. So we went to the Arc of Illinois Health the Speak Up, Speak Out Summit a couple of weeks ago for disability self-advocates. And Kristen has been invited to speak at the Illinois Alliance for Self-Advocates. So she'll be speaking in February. I will make sure that that you all get an invitation to join that meeting and support her. So give Kristen a round of applause. Great job, Kristen.
All right, thank you. Oh, Kimberly Johnson, I see you got your hand up, Kimberly.
Yeah, because Kristen is my girl. I just want to say congratulations again. And thank you, Kim, for all you do to support. And I just wanted to let everyone know that as of July, I am the new board president for the Arc of Illinois. So that is another reason.
Oh, congratulations.
Yeah.
Thank you.
Wait for you too.
Yes, congratulations.
Oh my God, this is just so wonderful. And she was referred by my girl Nancy, but Kimberly, we'll have to get you on to talk about the ARC, okay?
Mm-hmm.
All right, so does anybody else have any?
Thank you, Kim.
You're welcome, Kristen. Good job.
Yes, I got the opportunity because I went to the Arc of Illinois Speak Up, Speak Out conference 2 weeks ago, and one of the workshops that I attended was, I can't remember. Do you remember, Kim?
It was being a better board member.
Being a better board member, and that's hard for me because I run my own organization and my board, I don't know, my board, I'm trying to organize it, and this conference was so amazing, like blew my mind. At the end of the conference, the lady who was running the workshop was like, "You are excellent, and I really want you to speak on at my event." And I did. I thought the event was last Monday, but it was like a get to know me, right, Kim?
Yes, yes.
And I will be speaking in January to a statewide coalition, right, Kim?
It's gonna be in February.
Yeah.
Yes, February.
And Miss Kim was there also.
Yes, Miss Johnson, yes.
Okay, well, thank you. And you know what, Kristen, we'll highlight more information in November, because just a reminder, we're not meeting in December. And if you are presenting in January, we will get that information out.
Yeah.
The lady, I think it's Janae from St. Thomas Star. Is it Janae or Janine? Oh my God. Delano, Miss Delano. If you could put your information in the chat box, I want to email you and talk to you. And somebody else I wanted to email and talk to. Okay, well, I will think of it. 2 new messages here. I would think of it. I don't have anything else. Kim, do you have anything?
I do not. As they say, I think we can return 30 minutes to the people.
Hey, this is Kelly. Before we adjourn, can April McMurray share her contact information, please?
April McMurray White. Can you put your,
Oh,
you know
wait,
what?
I think that she has it here. And let's see.
I sure will. I'm sorry. I was trying to find that mute button. I'm multitasking here at a inquiry. Yes, absolutely. Okay.
All right, you put your information in there. And then Kim Peak, I want to say thank you for joining us. I really, really, really appreciate you being here. And if you have any co-workers or other library administrators that would benefit from this meeting, please invite them.
We'll do it. Thank you.
I'll send you an invite again next month. And because I tried to get in touch with the lady over at the Dalton Library, Miss Lily.
Yes.
I don't know if the email went through or whatever, but if you know anybody else that would benefit, we would greatly appreciate it. Like if you know the people at Robbins or Calumet City, we would greatly appreciate it, Kim.
All right, thank you.
All right, thanks for coming.
Thank you.
All right, hope
Thank
everybody had a wonderful time.
Yes.
At our party.
Thank you. Thank you, Suzette. Great job.
Well, I try.
You do
Anybody
it.
else before we go?
No, great job, Suzette. Thank you so much, you and Kim and the whole team.
Yeah.
All right.
All right. See you later.